there has been some reports in the media and through the FDA that these rapid tests may not be as sensitive in detecting Omicron as they were with previous variants of concern. There's still a lot of data that needs to be gathered to be able to make this determination. And some of the early laboratory-based data might suggest that Omicron has poorer performance during the early stages of infection. However, most of the laboratory data that I've seen has been for tests that do not currently have an emergency use authorization in the United States. I think that there's a lot of information yet to be determined about the sensitivity of rapid tests with Omicron. But just in general, I think it's important to note that rapid tests across the board, regardless of the variant of concern, do have a lower sensitivity than PCR tests. And so we would expect that there would be a bit of a delay between the ability to detect an infection early on with an antigen test versus a PCR test. I guess I'll conclude by saying I know that there's a strong demand for testing statewide, and testing may not be available. And if a test isn't available, that's okay. If you have symptoms, stay home. If they worsen, seek medical care. And do your best to distance and wear a mask when in public settings so that we can try to reduce the amount of transmission that we're seeing. And hopefully within the coming weeks, testing availability that is both convenient and affordable will become more available.